Hello students. Now in this video we are going to study about the hospital pharmacy organization. Okay? Unlike community pharmacy जो होता है ये majorly proprietor based organization होता है where the hierarchical level is not there. एक या दो personals मिलके पूरा pharmacy run करते हैं but hospital pharmacy ऐसा नहीं है. Because hospital pharmacy is located inside hospital, it might be operated with the hospital management itself. इसलिए वहाँ पे एक hierarchical pattern होता है for efficient running of the pharmacy. So let us study what is the organization of such hospital pharmacies which are inside the hospitals. Okay, so at the apex, at the top, there is a hospital administrator. The hospital administrator takes care about each and every activities of the hospital. Below to hospital administrator, there is a committee of all the HODs. When I say all HODs, head of the departments, it means in hospital there are various departments like diagnostic departments, radiology departments, then nephrology department, cardiology department, pediatric department. ये सब आ जाता है clinical services में. Similarly आता है pharmacy department, administrative department, okay, nursing department. तो उनके HODs का एक committee होता है which is working directly under the hospital administrator. Similarly, hospital administrator also takes care about PTC committee, Pharmacy Therapeutic Committee. We are going to study in detail about PTC committee in upcoming videos, but यहाँ पे मैं आपको short में बताना चाहता हूँ PTC committee hospital में एक ऐसा committee है which comprises of pharmacist and doctors, and together they decide the protocol or the drugs that needs to be made available in a hospital for treating various kinds of patients coming in. Okay, so they are basically involved in preparation of hospital formulary. Hospital formulary, again, it is a book which is referred by each hospital in order to create some protocols for treating patients. Okay, now apart from this too, there is one personnel which is directly under the management of hospital administrator, which is called as chief hospital pharmacist. ये जो होता है चीफ हॉस्पिटल फार्मासिस्ट, इसको हम हेड फार्मासिस्ट भी कह सकते हैं. एक हॉस्पिटल फार्मेसी में ही इज द हेड पर्सन who is working directly under the directions of hospital administrator. So chief hospital pharmacist is going to manage a team of different persons who will efficiently work for successful running of hospital pharmacy. So एक hospital pharmacy में these are the personnel who are working. The assistant chief pharmacists, it can be one, it can be many also. Okay, it can be one pharmacist or it can be one many also. फिर pharmacy का एक secretary होता है. Okay, a secretary is not involved in the technical work, but it is more involved in administrative work, majorly looking after the profits, the money required to purchase the medicines. The financial aspects is taken care by the secretary of the hospital pharmacy. Apart from this, there are staff pharmacists, pharmacy technicians and pharmacy assistants. Now you might feel कि सर हम तो मेडिकल में जाते हैं, हॉस्पिटल फार्मेसी में जाते हैं, वहां पे तो ये सब ऑर्गेनाइजेशन हमें दिखाई नहीं देते हैं. वी हैव नेवर एक्सपीरियंस दिस. So yes, in India you are going to experience this very less, because in India we follow a pattern of chief hospital pharmacist, and below to chief hospital pharmacist there will be multiple pharmacists working and some clerks. Okay, but if you follow or if you observe the hospital pharmacy pattern in European countries or Western countries, over there this is the system. There are below to head pharmacist, there will be assistant chief pharmacist. अगर सिंगल ब्रांच है तो मल्टीपल ब्रांच रहेगा, तो वहां पे रहेगा असिस्टेंट चीफ फार्मासिस्ट फॉर ईच ब्रांच, सेक्रेटरी. बिलो टू असिस्टेंट चीफ फार्मासिस्ट देयर विल बी स्टाफ फार्मासिस्ट वर्किंग टू सर्व पेशेंट्स. अभी फार्मासिस्ट का एक रोल होता है टू प्रोवाइड पेशेंट काउंसलिंग. सो इफ देयर इज ओनली वन फार्मासिस्ट एंड ही और शी इज बिजी इन काउंसलिंग वन पेशेंट, then what about the other patient? Who is going to take care about them? So there are multiple staff pharmacists who can provide service for at least 5 to 10 patients at a single time. Now, when a pharmacist is providing counseling, patient counseling, there are pharmacy technicians who start preparing the prescription drugs. जो भी prescription आया है patient का, a pharmacist is involved in counseling and technician is involving in preparing the order as per the prescription. Now, the people who help a technician to prepare the order, they are called as pharmacy assistants. So likewise, there are three important persons working towards successful running of pharmacy: staff pharmacist, which are involved in providing patient counseling; pharmacy technicians, which are involved in preparing the order as per the prescription; and pharmacy assistants, who help pharmacy technicians to prepare the order. Then there might be interns, because hospital pharmacy का एक function भी होता है to educate the upcoming pharmacists. So yes, there will be interns who would be working. And apart from this, there would be some non-technical staff which we consider as clerk. Okay, so in one hospital pharmacy setting, this is the ideal organization which is there: a hospital administrator, who takes care about various committees of all HODs or various HODs forming one committee. Then there is Pharmacy Therapeutic Committee and Chief Hospital Pharmacist. Now, Chief Hospital Pharmacy manages a team of Assistant Chief Pharmacist, Secretary, Staff Pharmacist, Technician, Pharmacy Assistant, interns, and clerks. Now, one thing I would like to mention over here is if the hospital is a multidisciplinary और सुपर स्पेशलिटी हॉस्पिटल जहाँ पे हॉस्पिटल में एक से ज़्यादा हॉस्पिटल फार्मेसी के ब्रांचेस है तो वहाँ कुछ और डिपार्टमेंट्स भी हो सकते हैं लाइक डिस्पेंसिंग डिपार्टमेंट वेयरहाउस डिपार्टमेंट क्वालिटी कंट्रोल डिपार्टमेंट एंड manufacturing department. So if this is the scenario, each of this department will be having staff pharmacist. Okay, because as per the rule, a pharmacist is the only person who is responsible for all the activities taking place in a premises, which includes storage and handling of drugs. So in all of this department, the function is related to drugs and hence staff pharmacist would be required to perform the function. Okay, so this is about the hospital or pharmacy organization. This question you may encounter for 5 marks in your exam. Write a short note on hospital pharmacy organization. Thank you.